How you doing?
Hey, I'm very good. How about you? I'm feeling
I'm good.
optimistic, you know that? I'm very hopeful.
So I'm I'm always
Things
hopeful.
are good. No, but
Yeah,
I'm feeling good. I'm feeling very hopeful.
good, good.
I mean,
Well,
I will say I was a little disappointed. We all were when we didn't go into gray. We would stayed in lockdown for 2 weeks. But I'm starting to feel things really are taking turning a corner. Turning a corner. Today we had what 55 cases. I don't think we've had cases that low since before Thanksgiving.
good. Okay, that's amazing.
I'm getting that number confirmed now. You know, I've got all the vaccine sites ready to roll
Okay.
when they drop, right? The hospitals are stable, the case counts are low, vaccines
Yeah,
are ready to roll. Things are looking good.
yeah, no, I think 21 is going to be a good year. It'll end up being a good year. Um,
Well, relatively speaking, it can't be worse.
yeah, that's true. Can you believe next Monday we're already in March? Okay, let's start this.
It'll be
Okay?
a year.
Yes. Yeah, let's not
March 16th, 1 year
that's
since we
crazy.
closed things down because it was the day before St. Patrick's Day to keep everyone out of the pubs.
I totally forgot about that.
Right?
So
Oh, I haven't. I don't remember exactly why it happened.
So let's get this started. March
Sure.
9th. March 9th will probably be the date that Mississauga moves into either the gray zone or possibly the red zone. What are you hearing?
You took the words out of my mouth. So it's exactly. I'm probably gray, but I'm hopeful for red, as you say. Lowest number since October 31st. Yep.
Okay.
Today's
So
today's number. So yeah, and it's trending. I got the numbers. I always, I asked for them a little sooner, so I have them for you.
thank you.
73 cases per 100,000.
Okay. And we have to
And
be at 40 to be at the red zone. Is that correct?
40, well, 40 is red zone. I think we could make an argument right now. Bramptons aren't bad either, right? They're averaging right now 115 per 100,000. But Peel is 88, right? Because we bring them down and Caledon brings them down. So Peel's 88. So we're gonna make the case. We're gonna make the case for sure. The R factor is really good. We're all under one. We're at 0.94. And the positivity rate is pretty good too. We're at 0.45. Caledon's at 4. Brampton's still at 7. But things are looking good. Peel 5.7. If we can get that positivity rate in Peel down to like 4, 4.5, and we still
So
have and we still have 10 days to do it, so we can.
what's your gut telling you? Red or gray? I think all the businesses want to know.
Ah, yeah, but it's not like my lips into the premier's my ear into his ear, right? He knows I want red. We know we all want red.
Yeah.
I'm hopeful. They might be cautious.
What's Dr.
Laura,
Lowe saying?
Dr. Lowe is very cautious,
Okay.
and so he may recommend gray, but we may, there's not that many differences. Gray doesn't give you much other than retail is open at 25% capacity, and you can have 10 people gather rather than 5. That's it. So red gives you a lot more flexibility, and I think you can even have 10-person indoor dining, correct? 10 people indoor dining. So gives you a little bit more. I'm very hopeful. Like things are
Okay.
looking very positive. I'm certainly going to make the case or try to make the case.
Okay. All right. So we just actually put out an article, in Saga did, confirming from police that at Pearson Airport, they're allowing people that flew in internationally just to walk out,
Is
right?
that right?
Yeah. So and they're not refusing. So if they refuse everything, they can walk out. But people that actually cooperate get a fine. Isn't that kind of backwards? And can you do anything about it? And this is confirmed by the police.
Is that right? Well, we'll certainly raise that up the stream. But I also am aware that it's the rules about 3 days in the quarantine hotel, shall we call it? It only applies to personal travel.
Yeah.
So if you're actually essential on business travel, it doesn't apply to you. You still have to quarantine if you come back from overseas or across the border, but you can go home and do it. You don't have to go to the quarantine hotel and wait those 3 days for your COVID test I mean, it's just another layer of protection, right? Because
Yeah.
presumably you've already proven you're negative because you had to get within 72 hours a negative COVID test to get on the plane, right? And then they're asking for another one once you've landed, and you're going to spend 3 nights to get the test result. But I'm quite sure that applies only to personal travel.
Yeah.
So, and as you say, so if you refused, you pay your fine and then just leave. That doesn't seem to make any sense. But those are federal rules. They're not our provincial rules, right? It's the federal government that manages the airport, and Health Canada and Border Services.
Yeah. But the Peel police are the ones that are governing it and giving out tickets. So
That's right.
it's literally all 3 levels of government trying to work
So
together.
are you telling me you can take an $880 or a $750 ticket and then just leave?
No, you don't even have to get a ticket. If you walk out, right, then they can't give you a ticket. They're not going to run after you, right? The only ones that get a ticket are the people that are cooperating. That's backwards.
Yeah, that doesn't seem right at all. I'll definitely raise that. That doesn't seem right at all. And also, just because it's just begun, I wonder if the Peel police even have the resources to do that, because I saw the lineups. You saw the lineups, and it takes hours to get through to the isolation hotels on the phone. And imagine if you're coming in from overseas, and you're obviously jet lagged and you're tired, and then you're waiting in line just to make the call to find yourself availability in a room. And
we just got this confirmation. They're like, unless they're kicking and screaming, we're not doing anything.
Is that right? Okay, so I'll follow up, but you're giving me information I wasn't aware of, so thank you.
Okay. Hold on. Oh yeah. Is the right approach for Peel Public Health? Oh yeah, so we just got this. We just got this yesterday. Peel Public Health is in charge of the vaccine rollout for the region. Was that a surprise to you, or were you guys ready for that?
No. A, we're ready, and B, we knew that was coming. But certainly the hospitals have been doing, their share of it as well, and we have deputized paramedics as well to do the vaccine. So no, our vaccine sites, we have 3 confirmed right now. So 7120 here, Ontario, which is just north of Derry. It's Peel Building in Mississauga, and then also Peel Chamber 10, Peel Center Drive in Brampton, and then of course we all know about the Paramount Fine Food Center, and it is in the field house, which we used to call Sports Zone. Right? So they're confirmed, and they're looking for a central location. It just hasn't been announced yet. I know what it will be, but it's in the south. It's South Center, and they'll have the ability to do 2,000 per day in March, and about 4,000 a day in April. But the vaccine sites, Paramount Fine Foods, can do 600 an hour.
Wow.
So an international center as well, right?
So many questions about the vaccine centers. So I guess if they're done per region, are people allowed to region hop to get the vaccine, or do they have to get it from Mississauga if you live in Mississauga or Peel?
Right. So this is a question I was asking as well, because I thought, if the next available appointment is in Peterborough, are you going to be required to go there? But no, you're going to put in your postal code.
Okay.
So you will either, if you're senior and you don't have a computer, you will call in and you'll give them your postal code, and you'll be assigned one of the vaccine centers to go and get your vaccine. Or if you're on computer, you'll still type in your postal code, and you'll be given an appointment at one of the local vaccination sites. So it will be done locally, but it is a regional program. It is a province of Ontario program that we'll be using.
So the booking would be done provincially, and then the shot would actually be done municipally.
Correct.
And then is it open? Is it going to be open like kind of 24 hours or 16 hours a day? Do you know?
So yeah, long days. I don't know I know you got great questions. I don't know the answer to that yet. It's not all confirmed, and I'm a little bit worried about accessibility issues. I know 80 plus is next after all the essential workers, and early March we'll be doing by age cohort, by age group, and 80 plus. And I'm just thinking about my mom, who's got a walker, right, a rollator.
And it was her birthday a couple of days ago.
Well, the 18th, yes. So. What will they do? I mean, of course, I'll drive her, but still, it's a long hike from the parking lot inside. Will there be wheelchairs? Will there be sites that are more accessible for seniors who have accessibility issues or disability issues? So those are some of the things I'm concerned about, especially in the older age groups.
Okay. I'll have more vaccine questions next week. I apologize. There's
Yeah.
everybody's asking vaccine questions.
We are ready. I mean, you saw we've got, you know, the table and chairs all set up, ready to go. We're just
Yeah, no, I saw that. It looks amazing. So
yeah.
I'll be the first one in there when well, not the first one, but I mean when it's my turn.
When we announce 29, right?
Yeah, exactly. Everybody, my favorite mayor. Okay, so last week the unnamed building that got tested for the variant. Do you have any more information in regards to that?
I do. It's all very good news. Yes, I do. Here it is. There were 8 cases. 8
more cases?
No, the original 8. There were 5 of the VOC, which was the B1351, which was the originated in South Africa, and 3 of the original virus. So there are 8 total of all the 500 swabs that they have done, and encouraged more people to go get tested. That was it. It was isolated, and largely on 2 floors is what they found out. So isolated, contained, and there were only the 8 cases. So that is very good news.
That is good news. So out of the 500, there was no other COVID positive cases?
Nope.
Okay, that is good.
But with VOCs in Peel, variants of concern, and the 2 we're concerned about now are the ones that originated in South Africa and in the UK. There are 60 confirmed in Peel, just a VOC, and another 200 suspected, which they know are they know it's a COVID positive test. They're just testing for which variant. Okay. So that'll add to our numbers. We're confident about our numbers, but that unfortunately will add to them. But over time, so hopefully they'll get distributed out over the next week.
Okay, that's really good news.
Yeah, okay. It's very good news. It's very good news, and that number hasn't moved yet, actually, since he announced it to us that there were the so there were 8 total. I'm being told. I'm getting notes.
Okay.
8 total. 3 additional. Yeah. We know. Okay. Same thing I told you. See, they're watching. They're watching. They're giving me responses.
8 total. So 0 positive out of the 500. The new 500. Okay. All right. Okay.
Correct. That's really good news, right?
That is good news. That's great news. So okay. So I talked to. As you know, I talked to the Mayor Brampton, Mayor Brown, every Friday. He says that Dr. Lowe checks every week to see how the city's doing as far as the COVID numbers go. And then he's going to ask him if the numbers go down, if they can open up a week early. Mm-hmm. Is that something that you'll be asking Dr. Lowe as well? Is there a chance?
Well, of course we ask that, and the numbers come in twice a week. I just got them, and then they come in again on Friday. So we get Tuesdays and Fridays, we get the numbers, and we're watching them very closely. Now, of course, we're always pushing him. I started pushing him on the Monday night call and said, so about that red zone, huh? Never mind, Gray. We're going to be in red. It'll be spring. We have vaccines. Our numbers. The hospital's doing great. So red zone, hoping for red zone. So of course we ask him. The one piece of advice Dr. Lowe did give the Premier that wasn't implemented was to open outdoor amenities. So of course we have our rinks open, but certainly the ski hills, and there's Chinguzi Ski Hill in Brampton, the Khaled Ski Club. There's no reason why those shouldn't be open. So we said, what about outdoor amenities? Please allow us to open those, because that's fairly safe. It's, safely distanced and etc. That can be managed. So they haven't done that. They didn't do that when they announced our opening. I think they just wanted the clean opening, but at least maybe for a Monday announcement, the outdoor amenities, because of course with the ski season is limited. We've had such great snow, and then now we have 4 degrees. It's starting to melt.
Sure. With I guess with the stay-at-home order extended to March 9th, are you going to tell people from Mississauga to stay in Mississauga?
Well, we do, right? Of course. So those are the rules. Everybody knows those are the rules, and it's just 10 more days now, folks. So we really encourage people not to cross boundaries, not to cross regions. And you know what? Our local retailers really need your support. So when we open, we've got to give them, show them the love, right? We've got to shop. We've got to go out and support them. They are they're our friends, our neighbors, local entrepreneurs. Some of them are family. We absolutely have to support our local retailers. So just hold off, especially if you're going to buy online or you're thinking of taking a trip over to one of the outlet malls or something. Don't do it, because in 10 days you can shop local, and we want you to spend money locally.
I passed by your neighborhood, I think, and I saw the F45. Is it still open?
The only way, the answer is no, they don't do classes there, but the owner probably goes in to tape the sessions that I do in my basement.
Oh, okay, right? So it's still open. I saw it closed, so I'm glad it's open. So I'm glad it's open. And my question is, have you talked to small business and like
of course, they're so disappointed. We are all counting on being at least in the gray zone, and then we kept in lockdown for 2 more weeks. And I understand that. I mean, I know Lawrence has always said he wanted, and so did Eileen Davila, 7 to 14 days after the kids went back to school. And now with the rise of the VOCs, let's make sure we're controlling them. They're not controlling us. Hospitals were still precarious, but things are much better. I have the hospital numbers too. They're averaging, around 50 inpatients, around 20 in the ICU. And then they have the suspected cases that are somewhere between 50 and 60 as well. But the capacities are good, 98% capacity. So where they're managing, they're holding their own, and that's all great news too. So we had to look at the indices, not just the case numbers, but all the indices. So the small businesses were enormously disappointed, extremely disappointed, as I was, because I was so hopeful they would at least open us up with 25% capacity. And then when they didn't, I think we all just, 2 more weeks. And I think my message the last time you and I were together was there's light at the end of the tunnel. It's coming soon, but not soon enough for everyone. So everyone's just holding on. They're all texting me saying, we drove through Oakville, we saw the lineups and, looking at wherever. And I said, yes, that just means there's pent up consumer demand. And as soon as you open your doors, we're all going to return.
Cool. And talking about personal care services. I know in gray zone, they're not allowed to open, but are you going to kind of try to vouch for them to see if they can? Because in the last gray zone, you couldn't open up small business, right? So I think there is still kind of wiggle room to kind of maybe get them open.
They can open in red zone.
Yeah.
And that's where I think I'm desperate, right? You're desperate.
You look fine.
No, I don't look fine, but that's okay. So we want red zone. We want to be in the red zone so the personal care small businesses can open. And those are all the hair salons, the nail salons. Same. So that's okay. That's okay. But they will. And I saw the article in the Pointer as well. They've got those are the spa workers, and a lot of them are women, female entrepreneurs, raising kids and supporting their families themselves. So a lot of them are female-run businesses, and they're suffering. They're suffering incredibly. So I would love to see us in the red zone so that they can open, and hair salons, nail salons can open. We can do a little bit of indoor dining. So I'm so hopeful right now. I am going to keep dropping that hint. I'm, of course, as my press conference tomorrow and next Wednesday, going to be saying, let's keep going for the red zone. Let's go for red. Let's go for red. Not gray. Let's go for red. We just need them to open again. I'm so worried about our small businesses, and they text me all the time. And there's a lot of confusion about, come on, Mayor, you got to open us up. What level of government does what? And I keep saying, I would love to open you, but I don't make that decision. The Premier does. They've got the essential list, and they've created the framework. I'd love to open you, and I would have opened with capacity limits, or at least close down the non-essential aisles. You know how I felt about the big box opening and not our small businesses. But we don't make those decisions, but we have the onerous task of having to enforce them.
True.
right? So
It sounds like Dr. Lowe and Dr. Eileen Davila have a lot of influence when it comes to.
well, they
Uh,
do, right? And we always said we would make our decisions based on the best advice from our public health officials, because we want to make decisions based on science, evidence, and data. And so when they speak of, we always said we would make our decisions based on their advice. So they do hold a lot of weight. They absolutely do. So when they say we're still a little bit worried, let's be cautious. And you know, what he said rings true with me as well when he said, Bonnie, do you want to open now and then risk all the gains we've made and only have to close back down at the end of March or April? Or do you want to just give it 2 more weeks? And then when we open, let's hope we stay open. The weather will get warmer. People will be outside. It'll be summer. More people will be vaccinated. Just give it 2 more weeks. And you know, when he makes that kind of argument, he's right. Let's open to stay open. Reopen to stay open, not to close again.
I'm all for that. Isolation centers, are they being used, these 5-star isolation centers?
I know, right? We fought so hard for them the last I checked. But that is because we have a great number of hotel rooms now. There is a huge capacity. So it was about 25%, 25 to 30%, right? And yeah.
Were they expecting more? I mean, were they expecting 100%?
Well, not 100%, but I think I was expecting them to be at least 50% capacity, that more people take them up on it. But if you can isolate safely in your home, I guess that's people's preference, right? You can just put your head on your own pillow. You can make a cup of tea when no one's around, you know, or have someone bring you a cup of tea to your door and then you open it and grab your tea. You know, obviously the preference is to stay at home if you can isolate safely at home, or maybe you're staying in the basement and everyone else is upstairs, or whatever arrangements you have to isolate safely away from your family. We thought there would be a bigger uptake. But not so. But 25% of the number of rooms we have is still a fair number of rooms, because I think we have probably 700 to 1,000 with the 4 centers, right? We have a lot of rooms available. So,
okay. I have some viewer questions here. This is non-COVID related.
Okay.
All right. So do you anticipate the Huron-Ontario LRT will make traffic worse? People won't sell it.
I know. This is one of the arguments initially that people raised. We're taking lanes away from a road that's highly used. What we're hoping is that people get out of their cars and use the train. You know, we have to encourage public transit as much as we can. And of course, it helps reduce GHGs. It has so many positive effects. So no, I don't think it will make traffic worse. I think there will be a dislocation as we're building it, because we will have to close lanes and close roads down to, you know, 1 lane each way. So that might be a larger short-term problem. I worry about that.
Would you say 1 lane each way on Highway 10?
Well, they're going to be building the train along Highway 10. They're going to do it in small chunks, right? But that will be a big dislocation for sure as we're building.
All right. So another question we have, we're going back to COVID-19. Is there going to be a website platform to register for the vaccine?
Yes, and I wish I had the specific information, but I don't yet. They'll make it available to us when they have vaccine, and will ask us to be ready to go. I expect closer to March when that's going to happen. Right now, when they have vaccine, they're still vaccinating essential workers and finishing off the seniors' homes, etc., and support staff of seniors and those homes. So as soon as it's open to, you know, the age cohorts, the 80 plus, etc., we will be announcing how you register for your vaccine. And as I said, there you can register online, and for those individuals who don't have computers, they'll be able to call essential, like a 1-800 number, to book their vaccine. They just need their address and postal code available.
Okay. Here's kind of an interesting question. Can grandparents that are tourists be vaccinated in Mississauga? I guess if they're here and they're not Canadian citizens?
That's a good question. I don't know that anyone's going to ask for, you know, your PR card or your, you know, your residency other than your address. You know, I don't, no one said we would turn people away. Anyone who wants the vaccine, we're going to give it to them if they qualify by age or by employment status. They'll probably call and just give their address and be given an appointment, I would think.
Okay, perfect. And then another question we have here is, any status on the independence of Mississauga?
God bless. I wish. It would solve a lot of problems, including one which would allow us to reopen sooner. And that was always the case, but I keep being told, well, you're only one public health unit. You'll open when Peel's ready. So yeah. I wish, but maybe this has put a greater emphasis on this, and people may be starting to realize why it was so important for us to seek independence, and to control our own destiny and manage our own affairs, and here in Mississauga, and do what's right for us as a city. And this was a campaign we underwent, and we didn't have that groundswell of support that I had expected us to get. And I think people just didn't understand the implications. I kept saying we transfer, $84 million each year to Brampton for policing and roads and planning, but people didn't seem to understand that it could reduce costs and it give us the ability to run our own city without, and now I hope they see the benefits now. Like, if we were our own standalone city, we wouldn't have to be encumbered by the performance and the case numbers in other municipalities. Notwithstanding, the virus moves, so we'll always be impacted by the surrounding regions, the surrounding municipalities, but they certainly see the benefits. They would see the benefits today. It's I'd like to have this discussion again, and I think that the Premier has said that he understands the case, he understands the business case for it. He wasn't prepared to do the regional governance review or complete it at the time, but I think in his next mandate, should he be elected, I think it's something he'd be willing to reopen. And I think people will see the case themselves now, how it could have changed direction for us, right? I have so many people, even within Mississauga, think the South should open and let those areas that have the higher positivity rates or higher case rates stay closed, but let the areas that are managing their case numbers open. So you see it even within the city, but certainly between us and the other municipalities that make up our region, there have been a lot of benefits, not just for me to make decisions for our city without having to go to the region appeal on different issues, right? There's so many benefits. I really hope we reopen this this discussion, and there's certainly cost advantages for us as well. I know Mayor Brown had suggested there would be a tax increase, and there may have been for Brampton residents. I'm not so sure about us. This is one of those things I just said my staff went.
The next campaign promise, I guess, for the next.
No. Well, I would love, it's not something campaign on, because, I was so certain this time they would take a look at the business case and agree with us that we should be independent. And here again, there has to be political will at the province. So I can't tie myself to a campaign promise I can't control, right? Right? If I can't control the outcome, it's based on political will at the province, then I don't want to make that promise. And if they don't agree, then I look bad. I'm going to try. I'm certainly going to try. I think it's the right thing for Mississauga, but I campaign on trying, but to be successful, we haven't been. Hazel tried, she was pretty effective negotiator and advocate for our city too, and she wasn't successful. So certainly it's something we will raise. And we'll raise it during the provincial election, I think. More than my election, their election, right, is something that we would like to see. And I hope that everyone who's listening, if they should go to an all-candidate meeting with MPPs, I want them to raise it and say, Mississauga should be a standalone city. Do you agree or disagree? Let's leave that as a ballot question for any candidate running in Mississauga in the next provincial election.
True. And there we have it. It's 5 o'clock. I went over 1 minute last week. Okay. Thank you so much. I'll catch you next week. Okay. See you later.
Thank you.
Bye.